Jitendra, a young man in his late 20s, was unfortunate to meet with a road traffic accident, RTA, and sustained a fracture in one of his legs. Initially, it was a simple fracture and was treated with interlocking nail fixation. However, the situation became complicated due to an infection. His condition worsened, his foot began to deform severely, some bone became exposed, and there was persistent pus discharge. When he came to us, we performed the Ilizarov procedure on his leg. About 8 centimeters of bone had to be removed and was subsequently regenerated over the next 8 months. Due to the extent of the trauma, his ankle joint became completely fused. Despite this, Jitendra was able to regain a normal and functional life.